Good day everyone, my name is Rachel Mahinay from Bees and Tree Lineager, and today I will be performing the PeriHeat application.
What is lamp application? The application of dry heat to the perineum with the use of infrared light. For the assessment, observe patient's skin for possible reaction to previous heat treatments and observe for a removed ointments and creams which are heat-conductive materials, and lastly, assess a pain relief obtained from a heat treatment. And for the objectives, to promote drying and healing of a perineal wound, to stimulate circulation, to prevent infection, to promote comfort and relaxation. So for our preparation, we have step number 1, review physician's order, to determine treatment area, type of application, and length of a time. Rationally, proper treatment applied at the right area facilities promotes faster and effective healing process. So for step number 2 in preparation, we have gather equipment and check it for safety factors to ensure orderly procedure. Bring lamp to the patient's room. Bringing equipment needed at the area of a treatment saves time and energy. And next, explain the procedure to the patient. Hello ma'am, my name is Mahinay Rachel, and this procedure is all about heat lamp treatment or PeriLight. This procedure will promote drying and healing of a perineal wound, to stimulate circulation, to prevent infection, to promote comfort and relaxation, ma'am. Step number 1 in a procedure, ensure that no more than a 60-watt bulb is used for a heat lamp or the infrared element is in place or infrared treatment. Additionally, to ensure safety, the right amount of light needed promotes healing and effectively of the given heat. Perform hand hygiene to prevent the spread of microorganisms. In step number 3, identify the patient by checking the name and identification on the patient's identification band, or ask the patient to state his or her name. Identifying the patient helps prevent errors. And for step number 4, screen the patient to provide privacy. And for step number 5, place patient in dorsal recumbent position, and the affected body area should be cleansed well and dried thoroughly. This is to provide full exposure to female genitalia. Drape the patient. To drape patient in dorsal recumbent position, the following steps should be followed. In draping prevents unnecessary exposure of body part and maintains patient's warmth and comfort during the procedure. First, place the blanket or the top sheet over the patient so that one corner of the blanket is pointed towards the patient's head to form of a diamond shape over the patient. In B, instruct patient to hold on to bath blanket. C, request the patient flexes knees and keep them apart with feet firmly on bed. D, wrap lateral corners of bath blanket around feet in a spiral fashion until they are completely covered. E, the corner of the blanket between knees and extending over perineum can later be folded back over the abdomen. In step number 7, place the lamp 18 to 24 inches, 45 to 60 cm from the patient. If lamp is any closer, it could be burn the patient. For step number 8, check for any discomfort, burning reaction, or other untoward reaction. Frequent checking will prevent complication. Do not leave irrational patient alone. And 9, instruct patient not to change position nor to touch lamp, to ensure continuous target area exposure and ensure safety. For step number 10, remove lamp after 15 to 20 minutes and check area for burning or untoward reaction. Desired amount of time of PeriLight exposure as ordered by physician to heat or infrared can prevent skin burn or any skin unfavorable reaction. 11. Reposition patient for comfort and apply vaginal pad. It is to promote relaxation and rest to the patient. Lastly, return equipment to proper storage area to maintain order and safety. And last, don't forget to wash your hands to prevent the spread of microorganisms. After all, evaluate. Drying of perineal wound is accomplished, healing is accomplished, circulation is increased to a compromised body area.